Thousands of people in Central Florida are starting to find out how much more they may have to pay for health insurance. WESH 2's Justin Shecker joins us live now in Winter Park with more on this big story because, Justin, bottom line is a lot of people may have to start paying a lot more for coverage.
And Nancy, according to the office of Congressman Maxwell Frost, there are 189,000 people here in his Central Florida district who are going to see their health coverage costs soar. And his main concern is that many of them may drop their coverage altogether.
My health got significantly better. I lost 50 pounds.
Nathan Boy has been more than satisfied with his health insurance since enrolling through the Affordable Care Act marketplace.
I liked it better. I know that's really harsh to say, but it was better insurance than my employer insurance I've had.
The father of three says his Obamacare plan is affordable and reliable in helping him live with diabetes.
It was only $28 a month, and that included 90% of my medications that I needed to stay healthy.
But now he's experiencing sticker shock with his monthly premium projected to soar should Congress let pandemic-era subsidies expire at the end of the year.
It's up as high as $733.
In his congressional district alone, Democratic U.S. Representative Maxwell Frost says nearly 1 in 4 people rely on the Affordable Care Act.
People are being forced to make impossible choices. Do I pay for my health care or do I not have health care?
Obamacare enrollment in the Sunshine State has grown to 4.7 million since former President Biden signed legislation in 2021 making discounts more generous.
No state has benefited more from the Affordable Care Act than Florida, and no state will be hit harder if these tax credits disappear.
Republican Congressman Randy Fine is still critical of the Affordable Care Act.
The notion of keeping healthcare costs down is a lie. Obamacare costs what it costs. What Democrats want to do is borrow money from our grandchildren to hide what it costs.
Fine says Democratic lawmakers are to blame for the shutdown, and it must end first before Congress can address health care reform.
This is not a debate that you have when the government is closed. You reopen the government and you ask your representatives to go to work to do it.
Boy says if his monthly payment does skyrocket from under $30 to more than $730, he'll need to drop his insurance.
We deserve a system where staying healthy is not a luxury, but one that we can all enjoy.
So while the Democrats are sounding the alarm about Floridians no longer being able to afford their health insurance, Republicans don't want to budge on health care negotiations until the federal government reopens. Covering Orange County Live in Winter Park, I'm Justin Shecker, WESH 2 News.